This is Dental All-Stars, where we bring you the best in dentistry on marketing, management, and training.
Welcome to Dental All-Stars. I'm Eric Vickery, president of coaching at All-Star Dental Academy, and I'm very excited to interview our guest today, a longtime friend of mine, as I've always known her as a hygienist and now as a hygiene coach. That is Lyn Dalsfoist, and I'm so excited to have you. We've been talking and planning for, it seems like, a long time now. And I want you guys to know we're going to talk to her about what it takes to create a successful hygiene department today. She's truly an amazing coach. I'll give you some background on her. She's obviously been a hygienist for a lot of years. 40 years you were a hygienist, exactly from, what do you say,
1982 to 22.
1982 to 2022 up in Alaska, where I met her. And she's retired to Las Vegas. Her and her husband reside there with her family. And I gobbled her up as a coach. And she does an amazing job with clients and helping them really understand not only how to grow your hygiene department from a patient volume standpoint, but also from a healthy quality periodontal percentage standpoint. We're going to spend a lot of time talking about that. But she has her MBA in health service administration. She knows her stuff. She's written a hygiene manual. It is beautiful. I love it. It's just everything I'm not. And so welcome, Lyn. Thank you for being here.
Thank you very much for having me over, Eric.
Oh,
Glad
absolutely.
to be here.
Absolutely. So let's jump right in. Let's get everybody going on hygiene. So you and I look at KPI numbers. We see numbers that's going on with clients. You know what we're looking for. What would you say prevents the hygiene department from truly thriving as a department?
Well, it's all about mindset. And I'll say that some dental practices and some doctors still think that hygiene is a loss leader. But I'm here to tell you from experience that if you give your hygienist the tools and the skills that they need, they will thrive. And your hygiene department can become a backbone to your practice because it is also a touch place with you and the patient. So you can give your patient proper care and they also become loyal.
So really, if you saw, make sure I understand you. So what you're saying is, if you have a dentist that's a perspective of, hey, I just get the patients in hygiene and do what we can with them, all of that, and it's a loss leader just to try to get them into dentistry.
Mhm.
What you're saying is maybe you're doing it wrong, and you have the different mindset on it to say, why not make it a profit center or a quality center? Is that right?
Correct.
Okay.
Correct. Because when you're doing an exam, you focus more on restoration versus focusing on the patient's perio, right?
Yeah.
So you do check all the grooves and margins and nooks and crannies around your teeth, but are we probing? Are we neglecting to probe our patient?
Mm,
And are we doing more bloody prophies?
yeah.
And
The
is
super
that what
prophy.
is that what we want to have our patients experience?
So let's talk about that. The super
Mhm.
prophy, the bloody prophy, it's been a long time patient, whatever it is. What do you think the causes are when it comes to under-diagnosing or the under-treatment planning of periodontal disease in a hygiene department to begin with?
Okay, so let me start with everybody knows. I mean, I hope everybody knows that periodontal disease is associated with some of the systemic diseases.
Yeah.
For instance, right, heart disease, stroke, diabetes, respiratory disease, to name a few.
Yeah.
Okay, so it is also important to look at that in the context of getting our patients healthy.
Yeah.
And according to the ADA, 47% of all adults, American adults, have perio. And by the time they're 65, it goes up to 70%. So in your hygiene practice, if you're having less than 30% of perio in your practice,
Mhm.
that you want to take immediate action, pay attention to
Got
that
it.
because that is a driver of your um, profitability in your practice.
In which case, then you would think, oh, well, this is not a profit center. It's not a productive thing.
Exactly.
It is just a loss leader. So I want to go back through that. So when we look at KPIs,
Hmm?
we look at that yearly summary tab, we look at the hygiene department and production looks great. hygiene, has this many hours, this many patients, there's some open time. Then we have that column, it says perio percentage. Now we might see numbers, we see single digit numbers in there,
Mhm.
meaning if they saw 100 patients a month, less than 10 of them were engaged in either a 4341 or a 4910. Those are the two that we're
Perio
tracking now.
procedures.
Perio
Yes.
procedures. Okay. Less than 10 of them were. So 9% or less. When you see that, what you're saying is, hey, how's that possible if literally 47% of all adults have perio?
Correct. That
Right.
means they're under-diagnosing
Okay.
the perio.
Okay. Now, what if, okay, I'm going to throw another statistic at you. I told you I was
Mhm.
going to throw you some curveballs. Okay. We know that half the people don't go to the dentist, probably the unhealthy half. So, what if their excuse from the dental office is, well, just all of our patients are healthy. We're doing that and they're healthy. Is that something you believe, you buy into, or do you think there's something missing there?
And here's the deal. Another reason why offices are missing the perio percentage is because of assumption. We are assuming that when you have young patients,
Mm,
presumably healthy patients, they may not have perio. So we, just let them be. They'll be fine. But unless you use your probe, you cannot verify. So what I do is every patient that I see gets probing 100% of the time. I see
yeah.
them.
Yeah. Yeah.
So that's the only way you know how much percentage is in your practice.
So the follow-up question to the client who says, "Oh no, all my patients are healthy," is okay. As long as they're healthy or not, doesn't matter. Either way, let me ask you this: does every single adult hygiene patient have a full periodontal evaluation? Now, is that 6 pocket depths and 6 bleeding sites and recession?
Full mouth periodontal evaluation.
Yeah.
That's
So
every.
what I hear from clients is, "Oh, we do a spot probe."
See,
What's the difference in that? Tell us why that's a
okay, the
problem.
difference between the spot probing and a full evaluation is because your patient's health change. Their microbiota in the mouth change,
Hmm.
and their response to the infection change. So you don't know from time to time, from 3 months to 6 months, what's the change that happened in the mouth. So unless you probe all the teeth, you would not.
You wouldn't be able to see it all. So
Correct.
most hygienists, I'm assuming, not a hygienist here, not a dentist. I'm
No.
assuming most hygienists probe
Mhm.
the back teeth. Yeah.
There's certain areas that the hygienists probe, but I can tell you this: I have seen patients who've had perfect probing, one appointment, the next appointment 5 millimeters, and
Mm.
then up, and so we cannot really tell. The only way we can is by using your probe.
So what do you say to offices that are like, oh well, we don't have time in hygiene, so we do that once a year instead of every 6 months?
And it's about time management.
Yeah.
Okay, you can do that, and you can make sure that when you do probing on a regular basis, you get good at it.
Hmm.
Okay, and if you have a technology that you can dictate to,
Oh,
like
good.
the dictation device, then that will make it easy. And if you have somebody who is there to help you probe and record for you, that
Yeah.
is also going to be. It's
Has to.
also, yeah, have to. It's also about arranging your operatory so that you're able to do it. For instance, how far is your computer from you?
Mm.
I've had offices that's computers on the other side of the chair. But if it's closer to you, if you make it happen, then that can be done. There's no excuses under under this under the sun that
Yeah.
you can't do that.
And here's what I would say to those listening. If all of the clients that we've helped do this in the past do it, why can't you? They're not spending an hour and a half. They're not spending an hour and 20. They're spending an hour doing a high quality hygiene visit with a full mouth periodontal evaluation at every single appointment. And what I notice, tell me if I'm right here, what I notice is even the healthy patients start to recognize that it's, quote, not just a cleaning anymore.
Okay.
They sit down and they know their numbers and they're paying attention.
Yeah.
Is that a
Yes, yes. Thank you. That creates value for the patient, especially when they hear. And I have patients who repeat to me what they had before, like, "Oh, that was a 3 last time. Like, what's going on?" Like, okay, that's a source of a conversation, right? and at the same time, when you create value, you also change other things in your office. Like when you have patients valuing their appointments, you're not going to have people canceling and not showing up for your hygiene. And by the way,
It's a good point.
just the cleaning,
Yeah.
excuse me. Are you seeing when you go have your teeth, your cleaning, okay? Are you
Yeah.
seeing a cleaning lady or are you
Yes.
seeing a hygienist? So you have your
Yes.
hygiene appointment.
Love it. Totally
Just
agree.
that's
That just make sure I active listening here. So when the
Mhm,
perio percentage goes up, because we're doing
mhm,
the full perio val, we're seeing cancellations go down. We're seeing
mhm.
increased value and urgency in that appointment, even for the healthy patients. Okay.
Correct.
All right.
Exactly, exactly. And guess what, Eric? There's another thing that it does affect the perio percentage effect. It does affect your production
Mm,
per patient because you're producing
yeah.
a more valuable code for the perio. And not only that, if you can control your open times, you will have a better production per hour.
Okay.
Can you see? Yeah.
Yeah.
So that all is affected. And in the end, what does that affect? Is their profitability. That's
Absolutely. Absolutely. So what is the target for I don't care where you live. What's the target for production per patient? And then we'll talk about production per hour. But what's the target for production per patient, would you say?
I would say about 200.
Okay. All right. And I'll give a soft range of 175 to 225.
Yeah, well, so
But
it depends on where you are because I'm used to
that's a
Alaska.
geographic thing. Yeah. In
Yeah,
Alaska,
exactly.
225. I know you have a
Mhm,
client there. I'm thinking maybe like Oklahoma or Arkansas or maybe Southwest Texas area,
mhm,
you may see, hey, we're struggling to get to that 175, but it's still
mhm.
doable. We see it all the time. Now, that's one, we'll call it 200. We'll say average 200 per patient. And what would you say we got to shoot for our production per hour then?
I would say 100, 200, 175.
Yeah. So it needs to match, right?
Correct.
It needs to match. If you're seeing one
You,
patient an
you,
hour, if you're going to go for 200, then 200. If you're going to go 175, it's going to be 175. Very rarely is the hourly production going to be higher than
mhm,
the production per
the per-
patient hygiene because a cancellation will obviously decrease your production per hour.
correct.
So let's say we go 200 per hour, 200 per patient, 175 per hour because we're still fighting against cancellations. When you put
Mhm.
the system in place, you see that 175 per hour get to the
Go
200.
meet. Yes.
Okay, got it. So how do we do that? How do we increase that level of hygiene, that patient care, that profitability? Give us some how-tos.
Sure, sure. Okay, the biggest thing I think is that you have to have a system where constant you will be able to diagnose and treat perio consistently. And when you do that, your production per hour, of course, rises up. When you implement that system, not only will you have the perio production, but also the succeeding appointments that that patient will get.
Mm.
So
They're more frequently
more
coming in
frequent,
for a
correct,
higher productive amount. I get what you're saying. Yeah.
correct.
All right. We'll improve it. I'm keeping good
So,
notes here. I hope everybody's taking good notes.
okay, and so yeah, so when and other things that you can do is your hygienist is not only trained to scale and polish,
Mm.
right? They're also trained, depends on the state's statutes and your hygiene scope of practice. They can also do other things. During the hygiene appointment, of course, you can do fluoride and irrigation and lasers, stuff like that. But they're also trained to do sealants. Some of them are able to do sealants. And I've had patients come in for aphthous ulcer treatment. That's an adjunct. You can do chair side whitening to increase the, your per hour. You can do that and not just doesn't take very long to
Mm.
do. And at the same time, you're producing.
Yeah.
And yeah, so it just utilize your hygienist to the max because they can't.
Mm.
Now, and then, as a doctor, if you're busy, delegate to your hygienist. I mean, I've been asked to anesthetize patients all the time, and
Mm.
that will give you time to prep the
Oh,
patient while you're
it's
doing
good.
somebody else. So
More
you're
efficient.
delegating. Exactly. And some states are the hygienists are given restoration endorsements. And I don't see a lot of dentists utilizing hygienists like that. But there's that they prep the teeth, and then hygienists can take care of the
Yeah.
restoration.
Like an
If you're
expanded function dental
correct,
assistant to,
correct,
yeah, I
just
gotcha.
use them. Just use them. And then another thing that I've done in my office that I don't see very often is referrals. Well, Eric, I'm not just talking about referrals from outside from marketing or referrals from within your
Mm,
patient. I'm talking about referrals from other healthcare professionals. For instance, I was talking to a cardiologist and he tells me, Lynn, I would wish to partner with dentists so that they can help me reduce infection in a patient's mouth because that's so essential in my practice to help the patient get better. Because, of course, relationship between heart disease and perio, the infection, they're all related. That, and you also have your oncologist. I have an oncologist patient who refers consistently to us those patients who did not have a dental home
yeah.
who can benefit from getting their mouth infection cleared before they get oncology
Their whole
cancer
body.
treatments. Oh
Yeah.
yeah. So that's another resource you can do.
Love it.
Another thing, sometimes we forget this. We send information to take home with patients when we do home care instruction. Instead of the patient buying products from the pharmacy, whatever, why don't you just have it available for them,
Ready to go.
purchase in your office?
Yeah.
Yeah, you can do even sonic brushes, even sonic
Mm.
tips, rinses, fluorides, whitening gels, and so on.
I'm not a guru at much of what we're talking about today. And one of those things I learned from a client, she's in North Carolina. She has I don't even know it's an Amazon store. And so she doesn't even keep the product on hand at all. She just has a storefront digitally. The
Ah,
patient
yes,
buys on her
smart.
Amazon site and it ships directly to them. They just have some samples there and say, here, click here and order it. And they get a small profit on it like you would have. And now I don't have to worry about shelf life. I don't have to worry about any of that stuff. So
That's awesome.
I
That's
love
out
that
of the box
idea.
thinking.
I love that idea. So I stole that one for sure. All right. Now I'll throw some other ideas out there in a minute, but
Mhm.
I will say this: when you talk about referrals, and the hygiene department being a backbone of the practice, I will say this: patients come to see their hygienist. When they come to the practice, they are excited to see their hygienist. They want to connect with them. They have the relationship with them. They are so important to this, which is a double-edged sword because as the hygienist, if you're listening to this, you've been seeing, Betty, your friend, forever, right? She's your friend. She comes in and sees you, and she hits that 45 to 50-year-old range, and she's been coming every 6 months, and everything's always been great. And then all of a sudden, you start doing that spot probe, and you start noticing some things. And because she's your friend, you have this good relationship with her. You're hesitant to then share with her what you're diagnosing, and you just go in and do that super prophy. And I know this is a thing, right?
Mhm, mhm.
We see
Yeah,
it
yeah,
often. We see it often,
always.
and I don't blame anybody for that. I totally would put myself in that and sympathize and say I get where you're at with that. How do you, as a long-standing hygienist, have these long-standing patients that you really care about? How do you tell them bad news?
Okay. First of all, I'm gonna use the friend situation because I already have their believability,
Hmm.
likability, and trust.
Yeah.
That's all taken care of. The only thing I have to deal with is how to present to them that they can understand in their own context. You know, if I've been seeing them for that long, I can relate to what's important with them
Mm.
over the course of the time, what's important to you. And now I'm seeing this condition that you have that it's not
That's
matching.
that's the key word I want everybody to hear is the condition here. Don't focus on selling, scaling, and root planning. Focus on the diagnosis, and how you diagnose is by actually doing the probing and calling the numbers out. So
Correct.
you're telling a computer or you're telling your assistant that there's infection, that there's bleeding, and there's all these things going on,
Uh-huh.
and the patient, your friend, just happens to be hearing it, right?
Correct,
So
correct.
yeah, focusing on
It's
that condition.
correct. And since you're your friend, they will likely to go for it because they believe you, they trust you already.
Mm.
And I tell you, I have not had many patients say no unless it's a condition that they can't do anything about.
Sure.
There's not much objection out there because they already know the value. We've already trained them with the value of this hygiene appointment
That's right.
through the years.
That's
And
right.
we know that, hey, you cannot always have a healthy gums. Well, one of these days, something will.
Yeah, I mean, as we age,
Mhm.
everything, different things are falling apart. You're getting high blood pressure, arthritis, diabetes, heart
Yes.
disease. Uh,
uh,
just,
uh,
just your body can't keep up, and the gums are a part of that, right?
exactly. Exactly. I had a patient who had been seeing me for a very long time. And all of a sudden, I go, what is going on in your mouth? Oh, well, apparently she's hit that time of the life
Her life,
cycle.
yeah, yeah.
Like, oh yeah, okay, well, duh. Now that's how we found out.
We're
So
all
he's
getting
just
older.
taking hormones and stuff. Yes.
Okay, got it. Well, the body, all of it's
Mhm.
connected. So, how I got some ideas here. So I'm going to see if
Okay.
we're in line with this next question I have for you. So, how does hygiene coaching help this situation?
Okay. So, what we do help the hygienists is to give them the verbal skills.
Hmm.
Again, it is so important to be able to explain to your patient the connection of the systemic condition and their oral condition.
Mm,
And then we give you the protocols to use in order to um, put that in practice consistently
hmm.
so that your patient you know what to expect. And your hygienist, if you have several hygienists, you want to calibrate it in learning how to
That
go over
is
this protocol.
so important. I mean,
Consistency.
yeah, same patient gets the same exact numbers no matter what hygienist they're seeing, or even the doctor. Everybody's calibrated at the same number because
Correct.
I've seen a Perio Pro before. I don't know who invented it, but it is left with a lot of free range on there. There's a couple lines, and you're supposed to know what those mean. And
Exactly.
can I see the line? Can I not see the line? Is it bleeding? Is it not bleeding? All of that
Yeah.
needs to be calibrated. Oh,
Right.
I'm
So
so glad you
yes,
said that.
and
Yeah.
yeah, we all look at the probe differently, don't we? And then different school. If you go to a different school, we look at it differently. So we do have the calibration even with the doctor. But when you have the protocol, you're gonna know what to say. Everybody says the same thing.
Yeah.
Another thing we do is it's important to learn how to do case presentation, right?
Yeah.
Not just for hygiene, it's important because, um, like you're saying, it's fear of rejection, right? You don't want to say something to your patient and be rejected for what you said,
Yeah.
right?
Fear is a
And
key word there. Yeah.
oh, you bet. And then this is also important that your hygiene is what I'm talking about. Being a loss leader, your hygiene can be the driver for your doctor's procedures in the doctor's side, because the diagnosis that you make in hygiene can make the production for the doctor's side. What
Absolutely.
do you say the percentage of cases that
Yeah.
come from hygiene?
Yeah, we were talking about this, huh? Yeah,
Yeah,
I remember.
yeah.
So, it really depends on the practice and how many new patients and the size of the cases they present. If they are presenting really large cases to a lot of new patients, they're turning that over, it could be a much lower percentage coming out of hygiene. But the average dental practice, I would say 45% of their production is coming from new patients, 45% is coming from existing patients, and about 10% could be coming through emergencies. There's a plus or minus there of
Yeah.
10. So that's about the average. So you're right. If your hygienist has really good verbal skills on case acceptance, it's not just about perio. It's you
Hmm.
get too perio focused, you just focus on perio, and
Exactly.
then nothing goes to the doctor side, right?
Exactly. And then it's important that you and the doctor, the hygienist and the doctor, know the philosophy of care in the office, because that is something that you can communicate with your patients effectively. And if you do know, like for instance, oh, this MOD, a crown with a three-quarter tooth is already involved, that'll be a crown. Well, it's not a no brainer. You can prep your patient to accepting crown, like, oh, this is hard. This is already large. You can expect it. By the time
Good.
the doctor comes, all he has to do is say, "Oh yeah, oh yeah."
Yeah.
You know, and
I get the feeling that your doctors that you worked for loved walking in to do an exam in your room because you just had them set up, didn't you?
oh yeah.
Yeah. And that's a
And
that's a skill that can be learned. That can,
mhm,
so
mhm.
so
That's
so
the skill we learn. We learned, and we could impart with you and could teach with you and coach.
that's right. That's right. I'll throw out some hey, how does hygiene coaching help? Simple discussion and finding out simple things like x-rays,
Mhm.
panoramic, and fluoride can grow a single hygienist anywhere from $35 to $70 to $100,000 a year, just on those three topics alone. So
Exactly. Correct.
there's easily a $35,000 annual potential in doing hygiene coaching to figure out these things. I see you get on a meeting, I get on a meeting with a client, and we look at that production per patient, we go, it's low. We start
Oh.
asking some questions, we find out we're just not billing the right way to get things paid and covered. Simple stuff, right?
Simple stuff. See, when we do this system that we're talking about, we give you the system in coaching. We include the codes that you would need to make sure that you're coding properly.
Yeah.
And with that the latest technologies, you can add to that. And let me give you a really real world example. Imagine this: if you can diagnose one hygiene patient, perio patient, at what is the average cost of hygiene treatment? $1,500.
Yeah, I mean, by
I'm
the
talking
time
about Alaska, but what?
Yeah, by the time let's use average numbers like quadrant of scaling route planning at 250.
At
So
250, that's $1,000.
we'll say $1,000. Okay.
Plus you add your adjunct, like lasers, like
Laser,
rinses,
sure, yep.
and antibiotics if necessary, and then a 6-week evaluation, and then
Yes.
the maintenance. That could add up to over $100,000. Just one patient. If you have several hygienists that will do that,
Yeah.
can you imagine?
You saying just one patient a day? Is that what you're saying?
That one patient a week.
One patient a week.
Right,
Oh,
right.
wow.
Yeah,
Okay.
I know. So I
It
did
adds
the
up quick.
calculation is amazing.
And I think that's actually pretty conservative for one a
I know.
week. I mean, you're talking, let's say they have two hygienists. So they're seeing, I mean, let's do the maximum. They're seeing, I don't know, 15 a day, 30, 60 patients a week, let's say. Okay. And two of them. So that's 2 patients a week. I would think that you could get 10 patients a week.
Can you imagine?
Yeah. Wow. Okay. Good to know. So how does All Stars Hygiene Coaching Program work? How do people find out more about this?
Okay, well, you can email All Stars Dental Academy and talk to Heather about it. And here's what I want to the listeners and viewers, instead of being a loss leader in hygiene, if you are if you're concerned about growth, if you're focused on growth, your hygiene can actually your hygiene also be a driver of production in your office can have hygiene.
Yeah. Yeah.
Just
I love
thinking
that.
of the growth on patient care, profitability, it can be the driver.
Yeah. I think it is the driver of the successful practices we look at. That hygiene department is an anchor. It is what the patient comes in for. They trust the hygienist. They're listening and converting. And I think with the right training, the right coaching, the right calibration, and with the right understanding of what's possible, you can turn a hygiene department into that. And if you're listening, look at your hygiene department. For every 1 day a week a hygienist works, are you at least producing $5,000 a month? That's a simple baseline. If you're not there yet, we should talk. Number 2, if you have higher than a 5% open time rate in your hygiene department, we should talk about cancellations with how perio affects that. Number 3, if your production per patient is beneath, I would say if it's below 175, we definitely need to talk. Your goal is to get it 200 to 225. Okay. Inflation, the cost, the employee wages, everything is playing a role in this. And so we want to make sure we talk with you. So like Lyn said, if you want to learn more about what we're offering and how we can help you with your hygiene department, just email Heather. It's heather@allstardentalacademy.com. And we'll be happy to discuss anything else with you and just have a conversation with you. Just sit down and do a consult and see what's going on with your practice. So thank you so much, Lyn. I really appreciate your time.
It's been a pleasure, Eric.
Good conversation.
Thank you very much.
And for those that are listening, thank you so much for joining us and continuing to take time to invest in yourself. Until next time, go out there and be
all-star.
We hope you enjoyed this episode of Dental All Stars. Visit us online at allstardentalacademy.com.